So I'm Tina Flores, the director of the Frontline Health Workers Coalition, which is hosted by IntraHealth International. Some housekeeping details. The bathrooms, I believe, are upstairs and downstairs. To view the program, there are sheets with QR codes at each table, along with some awesome buttons, which we'll talk about in a bit. So welcome, honorable ministers, special guests. On behalf of the coalition and our partners, Care USA, Chemonics International, IntraHealth International, Johnson & Johnson, Living Goods, Pathfinder International, Project Hope, Seed Global Health, and Smile Train. Thank you very much for joining us. The coalition is a pioneering global alliance that brings together a diverse network to drive meaningful change and empower the health workforce. The health workforce, after all, is the backbone and the heart of global health. We advocate for increased investments in pragmatic policies across all cadres of the health workforce, especially in low and middle income countries. And we also strive to optimize the impact of those investments. The last decade has been challenging, and the last 5 years even more so. We live in a time of multiple crises, not just health crises, but climate change, conflict, financial, to name a few. Health systems are being stretched to the brink, often without the time to recover. So crisis becomes the new norm. Likewise, health workers across all cadres are on the front lines, navigating the spectrum of health needs, addressing epidemics and the health-related consequences of climate change and conflict, while continuing to provide ongoing health services, such as those for maternal and child health, HIV/AIDS, infectious diseases, and NCDs. Health workers all around the world are stretched to the limit. We saw this very keenly during COVID. I live here in New York City, and we would make noise every day at 7 o'clock. And actually, one of my neighbors is this famous Broadway star, and he used to sing outside his window every day at 7 o'clock. But where is all that energy and love now? The reality is there are too few health workers, too few health workers. The WHO predicts a 10 million gap by 2030. That is not very far away, as you all know. We need to ensure that health workers are trained, retained, and that their physical and mental health is protected. Furthermore, health workers need decent employment and adequate compensation so that they are better to assure the well-being of their own families and communities. Greater commitments from all sectors are needed to realize a resilient health workforce. Yes, funding is absolutely critical. Investments are needed. We need large and small funders to make health workforce a priority. But equally important are technical assistance, pragmatic, actionable policies, networks to access resources, and the experience to leverage them and to use them wisely. We also need to listen and to learn from our country leaders. We're joined by 3 today that we know of, from the Philippines, South Sudan, and Burkina Faso. I'm sorry. I need more coffee. So sorry. Such as the And health workers, we need to listen to health workers themselves to develop locally led solutions and implement them in partnership with governments and communities. We also need strong leaders, especially women and health workers and women health workers, to drive progress and accountability. Human resources for health is a complex challenge that will take some time to address, but together we can dramatically accelerate progress. We invite you to join the coalition and be a part of change. Investments in health workers not only improve health outcomes, but also contribute to stronger economies. Without health workers, there is no health equity. Without health workers, health and development goals become unattainable. Health workers save lives. That's why I'm proud to announce that the coalition is partnering with Seed Global Health on the year-long campaign, Health Workers Save Lives. To learn more, access the QR code on the other piece of paper, but you also should have buttons at each of your tables and toward the front, so you can carry this message throughout the week and throughout the entire year. Finally, I would like to thank the Coalition Steering Committee, the event partners, and our amazing team at IntraHealth. And I'm going to make you stand. So please stand. Come on. Okay, so clearly we're a shy group. Today's dialogue will explore the challenges that health workers face amidst multiple crises and examine actionable solutions for accelerating progress on human resources for health. To help frame our discussion, it's my pleasure to introduce Patricia Odero, Deputy Director of Family Planning at the Gates Foundation. Dr. Patricia Odero leads the foundation's efforts to support design and testing of promising innovations that address barriers to the use of family planning. This includes generating evidence on the feasibility, cost, efficiency, and scalability of approaches that can further private sector delivery, digital platforms, and interventions that increase demand for and use of family planning. I welcome to the stage Patricia.
Thank you, Tina, and good afternoon, everyone. Yes, so Your Excellencies and all the distinguished guests, and I mean, it's wonderful to see a full room and so much energy around this topic. As somebody who started my own career as a frontline health worker, as a medical officer in an under-resourced rural district hospital, it's great to be able to see this topic area elevated and just solution orientation of everyone that's in the room. And so, as Tina mentioned, I'm here on behalf of the Gates Foundation, and just want to share some perspectives around the way we think on this topic and our investments around health systems and frontline health workers. So we do live in unprecedented times. I think Tina began framing this. Every day we're greeted by news of not one, not two, not even three, but multiple major crises around the world. These range from new and recurring epidemic threats to the impact of climate change, to conflict across and within borders. Each requires its own set of responses with a significant impact on health and, of course, on health workers. No matter what's happening in the world and in their lives, women, children, and families need access to health. And these services, access to services ranging from contraception, immunization, and malaria treatment. And healthcare workers, whether they are nurses, midwives, and doctors in clinics to community health workers at the last mile, do their best to show up and deliver for these women and children and families. We don't make it easy for these health workers. Undersupplied and often overworked, they must find ways to ensure the day-to-day provision of essential services and manage the health impact of crisis, all while juggling and protecting their own physical and mental health. The status quo is taking its toll and is unsustainable. Tina shared a statistic that's, I think everyone in this room is aware of. The WHO's predicted shortfall of 10 million health workers by 2030. We do need more health workers. And for that to happen, we need to better support them. In addition, we need to optimize the health system in order to allow the current health workforce be able to efficiently and optimally deliver the services they're tasked with. So at the Gates Foundation, we believe the health workforce must be a priority across all program areas, including the program team that I work on, family planning. So part of this is making healthcare workers and frontline healthcare workers a priority, and ensuring that even in time, and especially in times of crisis, they are not empty-handed. So we have an event that's about to start in the next hour or so that actually is focused on unlocking sustainable financing for reproductive, maternal, and child health supplies, so that when we are asking our frontline health workers to serve communities, they do not serve them empty-handed. There are many times when we go and visit facilities and we look at the shelves, and while the frontline health workers are showing up, they do not have adequate supplies and tools to be able to deliver services. And so while crises are not inevitable, they will nonetheless happen. And it's up to us, everyone in this room, to ensure that health systems are able to withstand these shocks, to minimize the disruption of service delivery while mobilizing the needed response. We need providers and products. Of course, you'll not be surprised when I say that as a Gates person. But yes, we do need both providers and products. And they go hand in hand quite literally. Without healthcare workers and products, we don't come close to providing basic care, let alone choice in care. Some examples, I know on my table, we're kind of talking about a lot of the events we go to often talk about, what are the problems, what are the challenges, but not really often on the solutions. So I want to leave you with a couple of examples of how we as the foundation are working hand in hand with governments, other funders and partners to be able to do this at country level. So the first example comes from our work in Ethiopia, where we are supporting the Ministry of Health in Ethiopia on the Health Extension Worker platform. Health extension workers serve nearly 20% of women using family planning methods. And I'm using family planning just as an exemplar, but really providing a whole range of services for women, girls, children, and families. And these health extension workers over time have been asked to do more with limited resources and oversight, which has led to low productivity and attrition. And so with our resources and those of others, we've been able to partner with the Ethiopian government on being able to improve the skills of health extension workers through a blended learning program that's being implemented by Last Mile, with support as well from Pfizer and GSK. We have been able to work with the government around the health extension platform optimization to be able to understand how do you reduce the burden on health extension workers who are at the last mile, as well as improving oversight, and therefore then increasing productivity. And then we've also worked with the Ministry of Health in Ethiopia to add increased staff at health posts, while introducing a new cadre of village health leaders that then is another layer of task shifting to be able to take some of the preventive, promotive, especially the promotion aspects of work away from the health extension workers. And lastly, we've been able to deploy, together with other partners, including some in the room, the mobile health and nutrition teams to reach hard-to-reach populations. Then the last example that I want to give is in Nigeria, because often when we think about frontline health workers, we really do focus on the public sector. And so in Nigeria, the example of some of the investments we've made are around optimizing the workforce that supports proprietary patented medical vendors, the PPMVs, which are really the drug shops. And so being able to work to enable proper training, accreditation, registration, and a tiering system, because a PPMV owners and entrepreneurs actually range in cadres, from nurses, community health workers, to people or individuals who perhaps just have a secondary school education but are passionate about providing health services to their community. And so how do we've been able to work with the regulators to be able to provide optimal training and also allow task shifting so that every PPMV vendor that's part of that network is providing the scope of care that is within their remit and within the skills that they have. And so that's really focusing both on health workers in the public and the private sector. And so I want to thank the healthcare workers in the room for everything you do. I want to thank the Frontline Health Workers Coalition for elevating the importance of investment in the health workforce. And also want to thank the leaders and partners around the world and in this room that are committed to strengthening the health workforce daily today for a healthier, more resilient world tomorrow. And really looking forward to a vibrant and wonderful discussion this afternoon. Thank you.
Thank you so much, Patricia. Can you hear me back there? Okay, just checking. Thank you. Oh, hi. Actually, he's here to see Alice. Thank you so much, Patricia. It's now my pleasure to invite Crystal Lander and Dr. Vanessa Carey to the stage. Crystal is Executive Vice President of Pathfinder International, where she leads Pathfinder's strategic engagement and high-level partnership. She's also the indomitable chair of the Frontline Health Workers Coalition and our #1 cheerleader. That's all in the mail. Thank you. And Vanessa is the co-founder and CEO of Seed Global Health, which focuses on health system strengthening and transformation through long-term investments and training of the health workforce. Vanessa is also the WHO Special Envoy for Climate Change and Health. Thank you and welcome.
Thank you.
Okay, we're on, great. So I get to have my Oprah moment with you, Vanessa. So I'm very excited.
I've always wanted to be on Oprah too. This is great.
I'm the fake Oprah.
But I'm on the Crystal Show.
Crystal Show. You know, we're gonna take that on the road.
I'll go.
Any of you who don't follow Vanessa or Seed Global Health on Twitter, do it right now on social media.
I'm not on Twitter anymore, but Seed is.
Seed is not. And follow my X, or LinkedIn really is the reason why I say that is because we know you have been all over New York, speaking and championing the issue of health workforce, but making sure you're making the connection to all the important issues around this. With climate, we heard that yesterday at the event, which just came through so strongly, and the issues with funding and supporting and integrating health workers into the health system. So honestly, on behalf of all of us, thank you, because we know it's a lot. We know you're doing a lot, and we appreciate the advocacy, truly.
Thank you, but it's just stone cold necessary, right? I mean, I speak as a health worker, colleagues who are health workers, and I speak frankly on the future of every problem we're trying to solve. Health workers are the front line of any response. So we just need everyone else outside this room to understand that.
Absolutely. And we're going to give you that charge before we're done. So one of the questions I had for you, I have a few, but one of them is, what did you say to what would you say? We have country government leaders here, including the US. What would you say to country governments about how do we prepare and retain this resilient health workforce? Like, what are these talking points you're saying here? We know ministers of health are just one piece of the puzzle, and we know they're all on our team. I'm looking at some of them now. I know they're all on our team, but what do you say to these country governments who may say, we don't have enough money. We don't have
always say there's not enough money.
There's always enough money.
There's never enough money. Well, the truth is, that's a thank you. There is enough money. There is enough money in this world to solve the pressing problems we want. We're talking about choices being made and choices not being made, right? And at the end of the day, we live at really, truly the most fractured time, at least in modern history, when you look at what's happening in the world. And it is everything from political conflict to what is truth? How do we seek and find truth to drive these decisions that we're making? We're being hammered by outbreaks and pandemics now, which are incredibly real. We're seeing disruption of services because of political mandates or because of pandemics or because of climate change, right? Climate change and health, something I've been advocating for a lot in the last year in this role as special envoy, but really as CEO of Seed Global Health, who is fighting to train healthcare workers as the leading edge of that response. Climate change and health is not a new idea. It is just accelerating existing problems that we have failed to solve. So that is the challenge. And one of those is the fact that we have always undervalued, underinvested, and undersupported healthcare workers. Yes. I don't know how many of you I know are healthcare workers. And whether you were serving in an ICU in COVID and had to live through that, or serving in a remote clinic during COVID, trying to protect patients without necessarily having access to the resources you wanted, or whether you were just trying to deliver a child in an inner city with a mother who never presented to prenatal care, the issues are the same. You are trying to provide high quality, dignified care to save a life and to give an opportunity and to position that person to live their full life in the fullest. So here's what I say. We don't have enough. We know that. We've heard the statistics. We know we're looking at a shortage, but beyond just the shortage, by the way, the shortage is going to be worse in sub-Saharan Africa. 6 million of that 10 million in 2030 are going to be in 55 countries on that continent. And the reality is they're already the most vulnerable to the impacts of climate change, despite being the least contributing. And by the way, having the least resources, not getting vaccines when COVID hit. We've consistently underprioritized, and it's time that has to stop. So we need more. And in a country like Malawi, where we work, for example, and have the deep privilege, there's only 30 obstetricians and 21 pediatricians for 20 million people. It's a ridiculous ratio, but we can change it. You know, going to solutions, we are trying to change it, and we're helping to train, and Seed just launched its 2030 strategy. And we're demonstrating you can train meaningfully. We've trained 42,000 healthcare workers in the last decade, and we're on the mark by 2030 to train another 100,000 more, with the goal to be able to do this.
That's amazing. Let's give that a round of applause. Solutions. Let's keep pushing. So the great thing about the Frontline Health Workers Coalition is that we have implementers, we have private sector, we have advocates. So I see many of you in the room. What would you say to them? What should they be doing to help with the solutions?
So I think, first of all, thank you for being a part of this movement. But I think it is really incumbent on all of us to get incredibly creative how this movement leaves this room, leaves UNGA, leaves New York, and actually becomes front and center of the conversations where the power is, where the levers get pulled, and where we can make a more systemic change. And so there's a number of ways we can do this. So beyond numbers, employment, retention, thinking also about what it means to preserve the investments we've made. We have to advocate for full fit for purpose workforce, right? We need community health workers. They're critically important, but if we do not have skilled referral and a solid referral chain for community health workers to refer to, the system falls apart. We cannot start to think of skilled professionals as too long to train or too expensive. It's not. The return on investment for health workers is actually quite profound. And that is the message I think we have to start talking about. What is the return on investment for investing in health workers? Well, it turns out that it can be for every dollar spent in healthcare workforce, you can get $2 to $4 of return on investment. Health workers, we've learned in Zambia, and our country director, Basim, is here, and other members of our team are here as well, who've been on front of Irene in Uganda. I've seen that when we train emergency medicine physicians, or we're training family medicine physicians, they're on the front lines of responding to cholera, COVID, Ebola, non-communicable disease, delivering babies, one person, all diseases. So if we do a better job of showing those changes in health outcomes, or that just by a year and a half of training health workers in Sierra Leone, in a district that had the highest rates of mortality within the country, mortality can drop at a sustained rate. It's for 60% sustained drop. And that is the statement that just training of healthcare workers and the priority of Sierra Leone has made. Those are real impacts that we can make. And so I think if we can start to demonstrate financial and security return on investment, talk about this as an issue of equity closing, of our security, of our humanity, and of the critical front line where you have a one size, in a sense that a healthcare worker is one solution for all problems. Suddenly it makes a whole lot of sense to be investing in the strong health workforce, the does primary care, is climate resilient, pandemic prepared, and able to meet the growing challenges we see today. All of you are living that every day in what you do. Now we have to go tell that story. And so this campaign that we are so excited to launch with you is just the beginning of starting to shake the understanding. I'm sorry, my back is to you. Of trying to help people understand that this is not a health argument. This is an economic argument. It's a security argument. It's a survival argument. Health is the lived experience of climate change. It is the lived experience if you are a migrant. It is the lived experience if you are in poverty. We can change that. And in 2024, as we sit in this room with all of our power, all of our possibility, it is our responsibility and should be our honor to go out there and try to make that shift.
That's incredible. That's incredible. I told you, I said, you follow her online, you get to see her say these things online. So I love it. You started a bit about the campaign. I know that this was, a culmination of ideas and thoughts on how to launch this and why. Tell us a little bit about what you want to get out of this campaign. What do you want to see when a year is over?
When a year, when a year is over, I'd like to see, I think there's a number of things. One, I would like to know that all of our colleagues who are in this room, frontline and community health workers, whether you're a specialist, whatever, knows that they are protected, they are supported, and they are not alone. I think that building that coalition is important. I think second of all, though, where I see the real opportunity is if we can see more funding than 7% of the global health funding going into the health worker needs, training the healthcare workforce, protecting the healthcare workforce, upskilling, putting in the core tools that they need, we will be making strides because it makes it more possible to close these gaps. So I think building that funding, tying the importance in this climate argument, lots of climate funding out there, hundreds of billions, but none of it is necessarily going, not a lot of it's going into health and less of it is going into health adaptation and resilience. The workforce is the #1 adaptation and resilience investment we can make for climate change and health. That funding should be moving here. Every political leader in this world should understand that health is a fundamental underpinning to the economic and security of their country, to the political stability, and to the future. And if we can start to change that understanding and shift, then we talk about this all the time, everywhere, and the investments come. And I think that that is the other possibility that we have here. And I think to see the numbers go up, the numbers retained. Look, you just opened like the Pandora's box of answers. So I'll stop there. It is merely to say that we should demand better metrics. We should demand seeing health workforce and health investments in nationally determined contributions in the climate discussions. We should see increases of funding going to this. This should be understood by governments as a chief priority. And the other thing I would say is I would like to see a lot of our multilateral funders, our multilateral development banks, and our big groups think about how they can make more flexible funding and shift to go behind country-led plans and country visions that are prioritizing primary care, health workforce, and those horizontal investments that build strength. We can achieve our vaccinations, our HIV goals, our maternal mortality goals, but we will do it more efficiently, cheaper, less administrative burdens, and with a lot more speedy progress.
Well, you all know what you're supposed to do this week, right? You have been given your marching orders. One is talk to someone else in this room that you don't know. That's the key thing, that you don't know. Make connections, coalition built, but constantly for everyone who lives in a country where it's a donor country, you should be advocating to your government the same things we're talking about. More efficient policies, but ones that are more flexible funding. And I know that that is something part of the U.S. advocacy group we do quite a bit. We have a lot of supportive U.S. members of Congress. We have a very supportive U.S. government, but they rely on us to give them the facts, to tell the stories, bring these things up front. They don't always have opportunities to visit countries where we get to see. They need these stories. We can't just share them with one another. We have to share them with decision makers. We also have to make sure we're constantly talking to ministers of finance, as ministers of health tell us all the time. They're like, look, these are people with the money. We have to make sure we're supporting them with the facts and the stories and the best practices. So this week, we know that you have ministers here, heads of state. We have so many opportunities to connect. Take this opportunity. I know it's a lot of walking, a lot of talking, but take this week to get out there. You shy people, this gets out of your comfort zone. Get out there, talk about health workforce. If you need talking points, if you need other points to make, it's a country you don't work in, someone's asked you, reach out to the Frontline Health Workers Coalition. We are a dynamic coalition working around the world, and we promise you we'll get you the resources. So with that, Vanessa, thank you so much.
Thank you.
I'm glad we were able to have a short conversation. And Tina, back over to you.
Thank you. Thank you both. That was great. Stay tuned for their podcast coming on the Frontline Health Worker Coalition /seed/Pathfinder channel soon. Speaking of ministers, we're so honored to have such esteemed speakers with us today from different countries. And the first one is the Honorable Dr. Robert Karugu, who is the Minister of Health of Burkina Faso, a public health physician specializing in health systems policy management. The minister has expertise in health service organization and planning, particularly in supporting the health system of Burkina Faso. Minister, I give you the floor.
Thanks again for inviting me to take the floor in order to speak just in 1 or 2 minutes concerning Burkina Faso experience in the field of human resources. First of all, I just want to say that despite the security and humanitarian situation that Burkina Faso is facing, and which command that the government put more resources in order to fight terrorism. The government is right now spending 12% of its budget for the Minister of Health. And this is really important, and I wanted to share it with you. Secondly, I want to say that in Burkina Faso, each year we continue to recruit and train human resources for health, such as general practitioners, midwives, and nurses. And I just want also to say that in Burkina Faso, we are investing in community health. And by this way, the country right now has 32,000 community health workers that have been recruited and trained. And these community-based health workers are, how to say it, they are motivated monthly. And this is founded by, indeed, with the support of technical and financial partners, but also by the government budget. So it is really important for me to share it with you. And right now we are working in order to professionalize community-based health workers so that they could be really effective in the work they are doing. So it is just what I wanted to share with you. And I want to invite you to come in Burkina and to invest, because if you invest in Burkina, honestly, as we usually say, value for money, you will have it in Burkina Faso. Thanks so much.
Merci beaucoup. Thank you, Honorable Minister. It is now my honor to introduce the Honorable Yolanda Awal-Deng, who has been serving as the Minister of Health for the government of South Sudan since March 2022. A trained psychologist and conflict resolution expert, the Honorable Minister held several key positions within the government of South Sudan. I will also say she was the first guest who joined us today. And Honorable Minister.
Thank you, Tina. I would also want to say that you and I have both got lost. So, yeah, I hope this is tall enough. Excellencies, distinguished guests, partners, colleagues, everybody in the room, I want to say Sabah al-Khair, good morning, good afternoon. And I bring you greetings from my country. I also bring you greeting from the leadership of my country and also from the healthcare family in South Sudan. I am grateful to be standing here today. I'm here with my team, the Undersecretary, which is the equivalent of the Permanent Secretary in South Sudan. And I'm also here with Honorable Estorina. She is the Commissioner in charge of HIV/AIDS in my country. It is our pleasure to be here today. I stand here before you with a pressing message. And this morning, I'm very happy that there were some speakers ahead of me. It seemed that we are in this space, sharing this space with common agenda. The issues that are impacting us, as my sister mentioned earlier on, 90% of it are going to be based in sub-Saharan Africa in the near future. As we gather at the UN General Assembly this year, we are reminded of our collective responsibility to secure the future of our people. And when I say our people, it's not only the people in Africa, it is like the globe alike. We are at the gaps of the new health challenges driven by climate change, challenges that will require resilience in our healthcare system, most importantly, our workforce, the backbone of what we do. South Sudan, like many other nations, is already experiencing the realities of climate change. Rising temperatures, prolonged droughts, and unpredicted flooding have intensified our challenges. Also, to bring it to your attention, about 7 million out of the 15 million of people in my country are at the verge of being of starvation, malnutrition. Waterborne diseases, malaria and cholera outbreak are more frequent and also heavier on fragile healthcare system. At the heart of our response to this crisis is our workforce, dedicated men and women, often working in the most remote and challenging conditions. It's only that, like, my technology failed, I would have just maybe projected a very small video to show you how much these women and men goes to a length. Sometime, you know, some of them have to learn swimming, like myself. I have to learn how to swim when I became the Minister of Health, because I came during the time when COVID-19 was just finishing, and we had to deliver vaccines to some of the areas that were highly remote and very difficult to access. The challenges our healthcare workforce faces are immense. The rural and the remote nature of many areas in South Sudan. And by the way, 56% of the areas in South Sudan have got limited access. And some of the individuals that have gone there knows what I'm talking about. Climate-induced migration and displacement have led to shifts in population dynamic, creating new and evolving healthcare needs. Our healthcare workers, already overburdened, must adapt quickly to changing circumstances, sometimes without necessary support. And by the way, as my sister mentioned here, my main area is the mental health field. And in South Sudan, we are also overburdened with the intergenerational trauma. We also have got a conflict that have gone on for decades and decades. People have not recovered. And who are the ones shouldering this burden? It is the frontline workers. As we speak, 7 out of 10 states are having a huge big flooding. The flooding that we have never experienced in 150 years. And then 2 states have extreme droughts for the last 5 years. So you can see what the frontline healthcare workers are going. They must be adaptable, they must be flexible, and they need resources. In response, the government of South Sudan, with the support of international partners, is committed to strengthening the resilience of our healthcare force. Through our Boma Health Initiative, we have begun to invest in community-based healthcare workers. These are like the frontline workers. 90% of individuals in South Sudan, including myself, I was delivered, as well as my sisters there, by traditional birth attendants. These traditional birth attendants do not have enough skills. That means that we need mid to advanced level of training. We recognize that building resiliency requires not just program, but system change. It demands collaboration between health strategies, environmental, agriculture sectors to address the root causes of climate-related health risk. In South Sudan, I established what we call One Health approach, whereby all the line ministries come together so to make sure the strategies we have are on point and are cross-cutting. What do I ask from Munga? What do I ask from all of you? What do I ask from the partners, the donors, the investors that I'm seeing in the room? I ask about a few things, maybe 4 or more. We cannot do this alone. So number 1, I'm asking for increased financial investment in the health workforce for development, particularly in training, recruitment, and retention of healthcare workers in vulnerable climate regions like South Sudan, as well as here also in the US, because I'm very sure the crisis that I have in my country, some individuals here in the US are also undergoing the same. So I'm asking for more in investment. And you are very right, my sister, when you mentioned there is enough money, but we need more political will. We need to make sure that our governments across the world put basic services as a priority. Basic services are a national security threat. If you don't have good healthcare, you don't have good education, you don't have food security, what population are you going to have in the future? So political will is number 1. Partnership, that's my ask 2. Partnership with innovation to develop and deploy climate resilient health infrastructure and technologies. For example, I have a few solar powered health facilities in my country, but they are not sustainable. So I'm asking for more of this development to mobile clinics to make sure that innovation, technological health, intentional digital solution for health is going to help us to combat the climate change issues. Number 3 is technical support and capacity building for our healthcare system. As I have mentioned, a lot of frontline healthcare workers, most of them have got limited education or limited skills in the sub-Saharan Africa. So intentional development in this area to enhance skills is paramount. My ask number 4, we need a unified global response to climate and health crisis. Climate change knows borders. The health consequences will affect all nations. We must work together as one community, one healthcare community, without discrimination, to prioritize healthcare workers in all this area. To conclude, ladies and gentlemen, our healthcare workers are the bloodline, the lifeline of our healthcare system. They cannot succeed without the support of the global community. I am requesting, I'm appealing to all of you to invest more investment in healthcare. And then finally, the projects that are being taken to most of these vulnerable countries should not be working in silos. You should come there with your grant, come there with your resources, but make sure that it is in the line with the government strategies, with the government priorities, so that like these silos is actually creating duplication, and it is wasting the dollar amount that like the taxpayers are giving so much. Thank you so much, and I'm very happy that I'm here.
Thank you, Honorable Minister. And It's now my great pleasure to introduce Assistant Secretary for Global Health, Lois Pace. She's responsible for advancing the U.S. international health agenda through multilateral and bilateral forums. She is also the Office of Global Affairs lead on setting priorities and policies. As many of you know, Lois is the OG champion of global health equity. And I truly believe that her leadership is the reason why it is such a prominent issue today. So let's give a hand to Lois.
It's lovely being among friends. They say nice things about you when you're in the room. Well, good afternoon. Thank you, Tina, Crystal. I know Vanessa had to jump. Vanessa and I went to high school together. I can embarrass her in her absence. So she's always been like this, just so you know. And obviously, honorable ministers, thank you for your remarks as well. Really grounding the work in reality. God goodness, why am I here? I feel like I feel really honored to be amongst all of you who know this topic much more than anything that I could offer. But as I was sitting here listening, I was thinking about a few ways that the U.S. thinks about health workers, health workforce, and adding on to what others have shared. First, I think people are aware that our Vice President Kamala Harris, was keen to announce and was at the front line of announcing our own commitment to our global health workforce. And I very much appreciated the Honorable Minister of South Sudan speaking to not only this issue globally, but also within our borders, because that is certainly how we have come to recognize and address it in the United States. A couple of key pillars to that initiative that the Vice President announced include both innovation and protection. And I'm touching on those pillars on purpose because as we talk about resilience, adaptation, evolution, we in the US really think of that in terms of how we can innovate in the sector and provide our dear health workforce with the tools required to advance the work, but also protect this workforce, right? Not just demand more and more and more of them or from them without resources, but without those critical areas of support that they require. So a few examples when it comes to innovation and protection. One, in the area of climate change, and just really glad that Special Envoy Dr. Vanessa Carey touched on this so fiercely and eloquently, as she always does. In the domestic context, we actually have been working through our Department of Health to support health providers, health facilities, and how they can sort of improve their capacities in the face of climate change. First, we're working with them on mitigation tactics, frankly, given that the healthcare sector is such a sort of a culprit, at least in our country, with regards to healthcare and emissions and other things we would like to reduce in order to advance our work in climate change. But then, as Vanessa was saying, the healthcare workforce and healthcare facilities are going to witness these changes with regards to climate change and how they affect health conditions, whether that's down the line with non-communicable diseases or immediately when there are fires or floods or other things that are happening in our communities. They're witnessing it and responding often first. This is obviously true globally as well. And so in addition to working through our domestic healthcare facilities to bring them up to the level that they require in this space and for this time, we're also looking at how we can advance and support the health workforce to address climate and healthcare issues broadly. And I want to really hone on a part of the health workforce that we don't talk often about. We talk a lot about community health workers, doctors, nurses, and others who are in clinics and hospitals. We don't talk a lot about epidemiologists and lab workers and others who are critical components of our public health workforce and who are also facing this increased strain, especially when we think about the prevalence of outbreaks and issues or diseases that can become global health emergencies. These people are tired. You know, everyone in this room is tired. And I speak for the sort of folks behind the scenes among us who also require this level of support. And obviously thank them for their enduring commitment to this work. But in addition to the work in climate change and the need to work at the intersection of health and climate, I also want to lift up mental health, because speaking of fatigue and speaking of burnout, right? I mean, I see a lot of heads nodding and I don't have to say more. Unfortunately, we are still dealing with a really critical mental health crisis amongst our health workers. I know that we face it in our country, and I can imagine that is true globally. And so in addition to the work that we're trying to advance in some of these other areas I mentioned, we absolutely have to keep in mind how we are supporting, again, protecting the health workforce, particularly with regards to their mental health. And especially as, you know, these climate disasters, these conflicts, they have a personal impact on people, as we see and as we know. Whether plenty of people who are working in hospitals in the US when disaster strikes are wondering if their own homes are safe, right? And they're the ones still going to work and just praying that their families, that their children are okay. And I know that that happens globally as well. And I'll say the thing, you know, I'll talk about the conflicts that we're facing, whether they're in Gaza, Ukraine, Sudan. The health workforce is caught in the middle of these crises, trying to address these issues with all of the might that they can and with all of the stamina that they can. And frankly, I think we're asking too much from them, that they should go in and do what they can to save lives, worried about their own. And that is something that I know we are fiercely committed to shining a light on, particularly in our Department of Health, working with partners like WHO and many of you in this room, but broadly understanding that there are great risks that our health workers face around the world that they shouldn't in the wake of these conflicts and other crises. I think the last thing that I'll offer is also something that's near and dear to me, which is preventing and responding to sexual exploitation and abuse and harassment. And this is something that we in the US and other countries really wanted to lift up or work to lift up in the wake of the Ebola response, the most recent Ebola response. But given where we are with MPOX, and certainly given where we are with humanitarian crises, some of which I have named, others that deserve to be named, the health workforce, the majority of whom are women, often face sexual exploitation, abuse, and harassment, in addition to the communities being served facing that. And so it is also our responsibility to say the things in that regard and to do the things that protect our workers, because again, they are working too hard to have to deal with that on top of everything else. I guess in conclusion, when I think about sort of how we focus our work, and I can get up here and talk about all of the commitments and investments and all of the things, you know, but in the wake of all of these high level meetings, I like to step back and think about the humanity of what it is we're trying to do. And so I appreciate each of you for keeping me honest and reminding me of the humanity behind our work, your work in this regard. And thank you very much for your attention to this issue.
Thank you, Lois. It's now my great honor to introduce Dr. Maria Rosario Singh Verheer, the Undersecretary of Health of the Republic of the Philippines. Tatler Asia said of Dr. Singh Verheer that her steady presence calmed a panicky nation amid the COVID-19 chaos. Now, if you've ever lived in the Philippines, and I'm Filipino, I can just imagine what that's like. So indeed, during the pandemic, the Undersecretary managed the Department of Health's COVID-19 response cluster. She began her career as a rural health physician and is an award-winning public health professional. Please help me welcome Dr. Singh Verheer.
Thank you very much, Tina, and good afternoon to all of you. I think it's an advantage that we are fellow Filipinos. Thank you to all of the ministers gathered here, to our colleagues, partners, ladies and gentlemen. Good afternoon to all of you. We are grateful for the opportunity to present the Philippines' views and experiences on building healthcare workforce resilience in this forum. And we'd like to commend the organizers, of course, the Frontline Health Workers Coalition, for highlighting this vital area in global health. The Philippines is no stranger to the challenges posed by climate-induced and geological hazards. And in the recent years, we have also become acutely aware of the strain on our healthcare systems that unforeseen health security risks such as pandemics can cause. The seismic shifts in the global landscape of health security that we have witnessed have allowed us to uncover some undeniable realities. One, that our healthcare workers are often, if not always, at the front line of our healthcare crisis. And two, that their resilience is fundamental to the resilience of the entire healthcare system. In the World Risk Report in 2024, the Philippines was found to have the highest risk index among 193 countries evaluated, highlighting the extraordinary exposure of our country to the phenomena of natural hazards and our vulnerability to disasters. From typhoons to earthquakes to volcanic eruptions, our nation has weathered an exceedingly large amount of health emergencies that have both challenged and honed our healthcare workforce capability to respond. This context underscores our keen recognition of the necessity to invest in and equip our healthcare workforce to face these myriad challenges. One of the means by which this is being done through our intensified efforts on disaster prevention, adaptation, and mitigation. Our overall policy direction has moved away from simple disaster response towards disaster preparedness and resilience. Under our national framework that adopts a comprehensive approach towards safer, adaptive, and disaster-resilient Filipino communities, health workers and their needs are given key consideration in developing plans for disaster risk reduction and management, which are applied across all levels of governance in our healthcare system. Recognizing the role of climate change and its threat to our communities, the Philippines has also embarked on measures to counter and prepare against potential health impacts by building its pool of experts from the healthcare workforce to tackle issues of climate change, disaster management, and public health emergency preparedness and response. This aligns with our strategy of managing a national healthcare workforce support system that will equip our healthcare workers with the skills and knowledge needed to respond to increasingly complex health crises. Through the provision of in-service scholarship programs, for example, our healthcare workers are able to participate in international and local trainings with the goal of filling identified competency gaps and strengthening the health sector's capacity to face health emergencies. Some specific competencies we are bolstering are in the field of health security. Learning from the lessons of COVID-19, the Philippines is developing a national action plan for health security, which outlines necessary skills to be built, such as the public health surveillance, integration of digital health solutions, and biosafety. Additionally, a broader initiative being undertaken by the country is to develop its healthcare workforce in terms of health governance and health systems and development. Academic and non-academic programs in these areas are offered for health workers at both the national and the sub-national levels, as well as for doctors deployed in our rural areas. This aims to ensure that there is a community of trained, competent, and equitably distributed healthcare workforce able to mount a comprehensive response to health events throughout our country. Complementary to these efforts is the strengthening of our Department of Health's Academy, or the DOH Academy, which is an online portal that healthcare workers can access for free to avail of a wide range of topics and subject matters. This enables for them to be equipped with the proficiency required for an effective health response at the community level. By making these modules available online and regularly updated to reflect the evolving nature of health threats, we aim to ensure that all of our healthcare workers are kept abreast of the latest information, while also allowing those even from geographically isolated areas to benefit from remote learning experiences. Apart from the capacity and strength building of existing healthcare workforce, we take into account the fact that there must be a healthy pipeline of future health workers who can help share the load of dynamic needs in health crisis response. In addition to doctors, nurses, and midwives, we also include in our consideration health cadres that we deem vital and relevant to health emergencies, such as nutritionists, dietitians, sanitary engineers, inspectors, as well as emergency medical technicians who can augment the effectiveness of our resilience measures. Our pre-service scholarship program aims to ensure that there is a pathway for aspiring health professionals to be included into the national pool of healthcare workers who will render service under the National Health Workforce Support System and other public healthcare institutions. Priority areas for deployment of health workers who are mandated to return service after these scholarships are underserved and unserved rural areas, national priority areas for poverty reduction and peace-building efforts, and areas with poor health outcomes. Health workers who become part of this program are entitled to receive competitive salaries and benefits. As of July 2024, a total of more than 1,600 physicians and almost 19,000 other human resources for health had been deployed, and the number of accepted scholars who may yet become part of this pool has increased by nearly 300% in the past 5 years. Amid these measures aimed at ensuring adequacy and competency of our frontliners, we also acknowledged and act on the important aspect of decent work and conducive environments by supporting the welfare of our healthcare workforce. This is done through interventions such as programs on mental health and psychosocial support and policies that advocate for health workers' rights and protections. Policy action through legislation is also being pursued to properly reflect health workforce contributions and benefits. Interagency collaboration has been essential in strengthening our healthcare workforce, and we continue to see collaboration as a critical element as we look to future-proof our health workforce against health emergencies and the threat of climate change. Our Human Resource for Health Network, a multi-sectoral entity that meets regularly to discuss and develop solutions to national health workforce concerns, serves as an important platform to harmonize policies and coordinate investments. A significant output of this network has been the National Health Human Resources for Health Master Plan, which guides our actions to build a responsive, practice-ready health workforce while addressing the issue on shortages, health inequities, migration, education gaps, and improvements in working conditions. And finally, we see health security as not only as a national pursuit, but a global goal. In line with this, the Philippines is collaborating internationally to ensure that we are collectively prepared for future health crises. We are actively engaged in the global discourse on health security measures, and we continue to establish productive bilateral and multilateral partnerships that will build towards a sustainable and equitable global health workforce. Recognizing that we have a pivotal role on the international stage with regard to health workforce dynamics, the Philippines is also leading in collaboration with WHO, a Philippine-Pacific Partnership for Sustainable Health Human Resources for Universal Healthcare and Health Security. To be launched in November this year, the initiative aims to catalyze actions towards strengthening the health workforce in our region, particularly among the Pacific Island countries. Through partnerships on training, knowledge, and career development, and discussions on retention strategies, the collaboration will redound to increased local capacities to respond to health security threats. As we move forward with these collaborations in line with the Philippine Diplomatic Initiative for a Sustainable and Equitable Global Health Workforce, we look forward to further opportunities to share potential innovations and solutions to our common challenges. In summary, we envision that through strategic steps in building the adequacy, competence, and welfare of all of our healthcare workforce, both locally and internationally, we can mount equitable interventions that will ensure that our healthcare workers, who are the backbone and most vital asset of any healthcare system, are protected, are resilient, and able not only to respond to, but also thrive in the future, in the face of future health crises. Thank you very much.
Thank you so much, Undersecretary Verheer. And I know that, one of the things we've been talking about as a coalition is, are there best practices across regions that we can leverage to really accelerate progress? And that's something that we'd love to engage with people, with the ministries on moving forward. It's a tremendous pleasure now to introduce Dr. Sonia Nishtar, the CEO of Gavi, the Vaccine Alliance. Many of us know Dr. Nishtar. She has built an outstanding career over the last 30 years as a national and global leader. She's a trained physician, and among her many accomplishments as federal minister in Pakistan, she was responsible for reestablishing the country's Ministry of Health. In planning these dialogues at UNGA especially, one of the gold standards is, will you walk through a deluge in New York City to see the speaker speak? And for me, and I know for many in this room, Dr. Nishtar is that person. So we're really very honored to have you. Thank you.
Good afternoon, everyone. And thank you, Tina, for those very kind words. You really humbled me. And thank you for your focus on frontline health workers. As I sat here, I was wondering whether I was a frontline health worker. Many of you are physicians, and we've worked in fancy hospitals and coronary care units and practiced tertiary care medicine, but we are, in effect, frontline workers when it comes to that. There is a very broad definition of frontline health workers. And for every category of frontline health workers, there are issues relevant to quantitative deficits, qualitative gaps, training considerations, ongoing education. And there are specific contexts in which you look at these challenges for each category of frontline healthcare worker. But if we were to pinpoint one category, and if we were to tell ourselves that we are going to prioritize action to make lives better for that category, I'm sure all of you would agree with me that it would be frontline community health workers. I see a lot of heads nodding. And I think the resounding applause is in support of those unsung heroes who are truly there on the front lines. And I think in many ways we have failed them. I was familiar with frontline health workers, as many of you are too, because we belong to the healthcare sector. We have an interest in health systems, and we work in these systems. And by virtue of that, we come into contact with community health workers as well when it comes to the delivery of immunization or contraceptives or malaria drugs or tuberculosis drugs. And by virtue of that, we come in contact with them. But the first time I really got a granular sense of what it is like to be a community health worker was not when I was in the health sector. It was when I was the Minister of Social Protection in the government of Pakistan. And by virtue of the nature of that role, I would be in the field all the time. I would visit the streets and the slums and the remote villages and go to people's homes and sit with them and try to get a sense of how to deliver benefits for them. And I had the privilege, humbling privilege, of delivering benefits to 15 million households, 100 million people during the COVID crisis. And during that time, I was constantly in the field, mingling with people, trying to understand how they lived and what it would make to make their lives better. And it was at that time that I actually saw the true lives of community health workers. And I think that they bear a quadruple burden. Firstly, these are young women. And as young women, they have very complicated lives. They're dealing with husbands in a patriarchal society. They're dealing with in-laws who are loath to their taking up jobs and leaving children behind. They're dealing with unplanned pregnancies and morning sickness. And in the middle of all that, we are asking them to deliver vaccines and contraceptives and drugs and do registrations. And they're bearing all that burden. And on top of that, they have to be in the field. Being in the field, a young woman in a patriarchal society, and millions of young women, millions of unsung heroes, means that they're faced with security threats and abuses are hurled at them and sexual advances, and they endure all that. And to top that all, the greatest irony is that most of them are not paid. We actually work in a global health system where close to 6 to 7 million frontline health workers are not paid as we speak. And one of the most humbling moments for me as the incoming CEO of Gavi in May this year was to be in the audience at a World Health Assembly event when a community health worker went up to the stage and said, I'm paid $10 a month, and I'm one of the lucky ones. We've got to change that. We just have to change that. So I don't want to make a big speech today with a lot of fancy words and a lot of tall commitments. But if there was one thing I'd like to change while I'm the CEO of Gavi, other than, of course, what I'm mandated to do, it would be to make a difference in the lives of these women. Because by putting cash and salary in the hands of these very poor women, not only will you create a better health impact because you're contributing significantly to the health system, you are also contributing to a global public good because they are the ones who deliver all the things for us that we talk about in these nice rooms. And you're also contributing to empowering women in very difficult patriarchal society. And the knock-on effect of that is something we're deeply familiar with. It means the girls go to school. It means better nutrition. It means empowerment. It means less abuse at home. It means a higher social standing for that woman. And it significantly contributes to reducing poverty. So at Gavi, we are moving towards our 6th strategy cycle. And in our 6th strategy cycle, which coincides with the sunsetting of the Sustainable Development Goals, we want to have concrete and meaningful health systems interventions where we are able to show results. And as far as the frontline health worker piece is concerned, we're very serious in trying to deliver something for these very disadvantaged women. We are also going to be accelerating our work in our 6th strategy cycle. As you know, Gavi as an organization provides access to vaccines for the world's poorest countries. We vaccinated 1 billion children over the last 2 decades. And now, as we move forward into our next strategy cycle, we are going to vaccinate the next 1 billion in half that time. We've launched our replenishment. Frontline health workers are going to be key to the delivery, so it makes all the more sense that we must invest in them. We need all of you to be champions for our replenishment. We are asking $6 billion for Gavi's next, $9 billion, I beg your pardon. We've already raised some, and hence the reduced figure. All of you are champions. Please join hands. Let us help us make this world a better place. Thank you very much.
Thank you, Dr. Nishtar. Well, I know you've been a champion of NCDs, UHC, and now immunizations and frontline health workers. So I think we are in good hands, and we thank you for your leadership. So now we're going to, let's take a pause. And why do everyone who is a health worker please stand? Amazing. Thank you. And thank you for being here. So I'm going to turn it over now to our illustrious panel. And I'd like to introduce my colleague, Rachel Dessem, who is the Senior Health Practitioner of the Global Health Division at Chemonics International. She is a health systems and workforce expert with 20 years of experience. She's also a trained doula, and she is chair of the coalition's new technical working group. Rachel, I turn it over to you. And we've had some shifts as some folks have been leaving, so please feel free to grab a seat toward the front for those who have been standing in the back. Thanks, Rachel.
Thank you. Thanks for staying with us. And for that, I will speak right into the mic. Great. So I'll invite my esteemed panelists to come up. Maria, Thomas, Aaron, and Alice. Great. So thank you so much, Tina, for that lovely introduction. I'm really happy to be here and to continue to build on the amazing advocacy and messages that have been shared. So honorable ministers, all protocols observed. Bonjour à tous et à toutes. Thank you so much for being here. It's an honor to engage today with these incredible panelists on a critical topic, how to integrate resilience into primary care. Before we jump in, since we're not too far from Broadway, I just want to confirm, do we anticipate an intermission, a potential intermission, or are we okay? All right, we're just going to go for it. So primary health care is the vehicle to achieve UHC for all ages, all people, to promote well-being, to prevent infirmity, to cure, to comfort, to rehabilitate. And so much is being stacked on the PHC workforce. Add on top of that pandemics, social, political, shocks, stressors, floods, disasters, and conflict. So what does it mean to integrate resilience into the primary care workforce? Today, we'll reflect on this on the individual, interprofessional, and institutional levels, and consider, as many speakers have noted, the wide and diverse range of health workers that are on the front lines, from the majority female community health workers to doctors within private clinics and public facilities. Saving lives should not mean that you risk your own. Health workers face significant occupational risks, physical, mental, chemical, biological, and health systems need to anticipate and mitigate these risks. Health workers need standards and clear scopes for their practice to be safe, and also autonomy and leadership capabilities to respond to the situation in front of them. Investing in health systems for health workers is a win-win-win-win. Better care for populations and safer enabling environments for health workers and for the economy and to advance gender equity. So, who better to share their experiences, innovations, and solutions than this panel? So I have to my left, Dr. Maria Kolistenko, Medical Coordinator at Project Hope Ukraine. I have Mr. Thomas Opio Onyango, Country Director at Living Goods Kenya. I have Ms. Erin Stieber, Chief Programs Officer at Smile Train, and Ms. Alice Lynn Fabiano, Global Head of Social Impact and Partnerships for Global Health Equity at Johnson & Johnson. So welcome to you all. Thank you for being here. So let's jump right in. Dr. Maria, thank you for being here. Frontline health workers in Ukraine have faced unimaginable stresses and challenges and losses. How can health systems deliver the range of psychosocial needs for health workers, in addition to ensuring their physical support and safety?
First of all, good afternoon, everyone, and warm greetings from Ukraine to you. And let me start. My organization, Project Hope, is health and humanitarian assistance NGO, has been present in Ukraine since 2022. We're providing direct support to victims' people and support medical institutions and medical workers as well. You're asking me about mental health need for health workers, which is a challenging issue. The first challenge we faced developing psychological projects in Ukraine was the strong stigma around mental health. There is still hesitation to accept that psychological support is a basic necessity, especially for people who lived in crisis area. And unfortunately, mental health issue remains some kind of taboo. Overcoming the stigma is a critical step to cultivate mental resilience and responsibility among healthcare workers. Education of medical staff is the key. We as organization providing some types of trainings. One of them is teaching health workers how to provide psychological support to patients, and another one is Health Cell Plus trainings. Additionally, we're developing some new methods of mental health supporting medical workers in rural area. Telemedicine offers a solution to increase accessibility for it. Remote psychologists can provide vital assistance to health workers, helping them get through their personal strategies.
Thank you. And do you want to tell us more of some of the successes or the examples you've seen of these investments?
Yeah, sure. We have implemented telepsychological sessions in the area like Donetsk and Zaporizhia, the area which are under constant shelling and attacks. Our remote psychologists can provide psychological sessions to help health workers go through their personal grief and tragedies and come back to their ordinary lifestyle. Another case is how we faced with stigma in Ukrainian health facilities. When we first came to a hospital in Mykolaiv, Ukraine, to offer us health and psychological trainings, such as gender-based trainings, gender-based violence trainings, and psychological first aid trainings, we face some kind of skepticism. The head doctor was sure there's no cases of gender-based violence in all the region, and dismissed the sense of psychological support in general. we didn't give up. We start talking with them and offered them some of our examples, some of our experiences in these cases. Over the time, he started understand that just because trauma it wasn't visible didn't mean it wasn't there. We, for now, we're supporting this hospital, and the psychologist who works there has supervised by our MHPSS team from Project Hope. We offer them a lot of trainings, health self-plus trainings, and additional one. And one of the key shared by medical personnel after training was the importance of focusing on well-being, because one can effectively support others only when they have enough resource to do so.
Thank you so much, Dr. Maria. And yes, it's essential that we, give oxygen to those who need it before we can help others to breathe, surely. I'll invite you, Thomas, to take this microphone, if that's okay. Yes, so Thomas, welcome. This year, we saw unprecedented flooding in Kenya and the impact on health on many communities. So tell us about the role of community health workers. How have they been responding to health emergencies to build resilience of those community health systems, which are really essential for achieving primary care and UHC goals? What lessons have you learned?
Yeah, I think great question. I just want to start by stating that community health workers are actually not just the first respondents, but I think they are the heroes at the front line whenever there are such pandemics. And even as we look into the future, we can actually see a trend that there is growing impact of those pandemics by the day, of course, given the climate change. Now, back to Kenya, a couple of things. I think most recent one I think you're referring to is in May, we had devastating flooding across the whole country. Some broad numbers, which are that about 100,000 families were displaced, 300 deaths or fatalities, and about 45 hospitals or health units destroyed. But I usually say this is just more than statistics. I think when you go deep down, the stories are even perhaps much worse. There are many livelihoods that are destroyed. There are many people, if you talk about those numbers, 100,000, then you start imagining the most vulnerable, which is mothers and children. Because again, if you look at it, and I was listening to a debate today around the fact that if you look at the larger South, they contribute less to this climate change, but the impacts are disproportionately affect them much more. But further, even if you look at it in country, it's even again, the dynamics are much worse. That the people who are impacted much more are the poor of the poor. So it's going to be people in the rural areas who naturally have no access or any form of healthcare apart from the community health worker. Or if it's within towns or cities like Nairobi, where I come from, it's going to be the person who lives close to the riparian land, informal settlement, who'll be swept away by the floods. Now, naturally, when these things happen, then there are things like the waterborne diseases, diarrhea, cholera, there's rice, there's a surge, there's malaria. And for children and mothers, of course, when there's that displacement, they'll be taken to some rescue centers. Perhaps it's just a church with a tent. It's cold at night, pneumonia, there's increases. Now, community health workers are embedded within these societies full-time. I mean, their job increases even much more. They're the ones who then can diagnose, can treat, because they live and experience it with them. When there's displacement, they're also displaced alongside them. So for me, part of them is really just in terms of diagnosis and treatment and fast report and supporting the families. The second key piece, you look at other avenues like sexual and reproductive health, FP services, vaccination, because remember the clinics are even disrupted completely. So if governments will come with creative means about outreaches, but who is this who's going to go back into the family and identify those mothers, encourage them so that if they go for these outreaches, it's a community health worker. The third piece is really around rebuilding, because there's a role around rebuilding those livelihoods even after that, even post the pandemic. I think the most trusted person right there is going to be the community health worker, and that's what they do. In terms of then learning, and there are many more other things that they do, those are just a couple of examples. In terms of learnings, I'd want to pull in a couple, and one of them really is the role, and I had it articulated here many more times, is the role of building their capabilities as part of that resilience. So that starts by training, routine things like in-services, a lot of over-investment into that area, because the more they have the capabilities built, you increase the odds that they can actually advise and support families even much better. The second key piece is really around some support structure, whether through supervisors or also other interventions around the government system, so security, the police and all those sort of things. Because this is the trusted person within, who can support, but they also need support themselves, because the more vulnerable they are, the less effective that support will be. And the third key piece, which has been critical, is really around use of digital tools, data and digital. So the more they're equipped, the better. I think one of those cases was in an escarpment somewhere in the Rift Valley called Maimahiu, for anybody who knows Kenya, and a dam burst its banks. And in one morning you wake up, 45 people are dead, but many more are unaccounted for. So if you look at even our data and statistics and the census, they're more of estimates. The people who have the most accurate data real time is the community health worker equipped with digital tools, because they have a census coverage of the entire area. Thank you.
Excellent. Thank you so much, Thomas. And, I know in Kenya, a lot of the devolved responsibilities for financing, for making this all happen, is at the county level. So tell us a bit about the partnerships and innovative financing approaches that you have taken. You guys can hear us okay in back? Yeah? All right, good.
Yeah, great question. I think, when I look at it broadly, it brings us back to part of the discussions around the table, which is around the role of partnerships. As an organization, what Living Goods does is really supporting what we work with government through what is called a government-led approach to do what we call in co-financing, co-implementation. And of course, a country like Kenya is a devolved structure of governance, just for the details. So what we do is you go and co-design, co-create, and then including costings, but also it's beyond money. There's an element also around there's the money, but also there's the managerial capability, and we work with them towards that. I think part of what we've been very successful on is ensuring that within those realms, that it's also not just bilateral, like Living Goods and the government, but you bring in all the other partners. So there's strong partner coordination and synergies towards one front. Overall, I think then part of the key things that are happening is we are able to guarantee that the foundational key pieces for a functional health system are there. Community health workers can then be effectively trained. There's money for supervision. There is a commodity that's needed. And even critical piece is remuneration, including a lot of advocacy even from ourselves to ensure that the governments are doing it effectively. That's one. The other key piece around it is through that partner coordination mechanism is around basically driving efficiency and synergies. I had Minister Ndeng talk about it a lot, about the verticals. So that invariably is killed, because it's one strategy, everybody's aligned to it, it's complementary, and there's joint accountability. So you get much better results, you get a longer stretch for every dollar, and you get value out of it. The third key piece I wanted to touch on, which is critical, there is also around innovation. And if you look at it, and I'm sure we've had a lot of pronouncements around Kenya in the past 1 year, momentous announcements around really digitizing and revamping the entire community health system. Part of those things that co-financing, co-implementation allow is then allowing government to start moving, adopting innovation. So part of, if it were not for that co-implementation, then government will not have access to even start thinking of how then do we digitize and what are the benefits, what are the value. But then through those creative mechanisms, part of the success has been that, so which has been very, very useful.
Thank you so much, Asante Sana. That's a lot of really good solutions and really concrete examples. Great. So over to you, Erin. Tell us about solar surgery and its potential adaptations and applications. How is it mitigating and responding to impacts of climate change, as well as providing essential services in conflict and fragile settings?
Thank you so much. And first of all, it's just an absolute honor to be here with so many partners and leaders and frontline health workers. Smile Train is the world's largest cleft organization, but also for 25 years, we've been partnering directly with local hospitals and local health systems to empower local health workers on the ground with the training, tools, equipment, and funding that they need to be effective in the settings where they work and to provide essential cleft surgery and related cleft care. We work around the world, but Sub-Saharan Africa is certainly one of our biggest regions and our biggest growing regions in particular. And we've consistently seen, as many of you have, just massive gaps in the need across health systems. There are significant gaps, as we've all heard about, with regard to the number of health workers that are currently there, and growing gaps as we look to the future, and also significant infrastructure gaps. And so we've really been actively working to try and bridge those for more than 25 years now. What we've done in part, again, is to look at the health systems where we're partnering and to assess through local communication what those providers need. So it's all about the partnership. It's not a one size fits all. It's us understanding the local circumstances and listening to what we're hearing so that we know how to serve both those providers and those patients, so that the providers can ultimately do their best for the patients. And one of the things that we've really been looking at as our surgeries for cleft are often directed at children is the complete lack of access to pediatric surgery. And so we've been partnering since 2019 with an organization called Kids OR to build out pediatric operating rooms so that, as Dr. Odero said, we don't, put frontline health workers and health workers out there without giving them what they need to serve the patients that they're seeing. And that's been a huge part of our investment. But as we were building out these ORs and equipping these centers, our regional director for Africa, Ms. N.K. Obi, was saying, this is amazing, but we're still hearing about these rolling blackouts. We're seeing NICUs where babies are dying because the power will be out for extended periods of time and the generators are not effective. We're seeing patients scheduled for essential cleft surgery who get canceled again and again because there isn't electricity to power the operating room. So what we started doing with our partner Kids OR was investing in these incredible solar OR settings. And we really focused on making sure that the health system had ongoing power for the operating room, which is one of the highest consumers of energy in the hospital, so that these cases could continue and essential surgery would be available for these patients. And I'll note that when cases are canceled, obviously there's a massive burden on patients and on providers. The cases that are canceled are often the most vulnerable patients, such as children. And the cancellation of cases can also impact remuneration for the service team. So it has this knock-on effect. We've also heard stories of, surgeons and anesthetists and others trying to continue an essential surgery by their iPhone flashlight, working without essential monitoring, which is just unacceptable. And then they can be there twice or three times as long as they would have expected for a shift, have to travel home at night, which is unsafe. So there are massive knock-on effects. And we're really, really proud of how this solution is helping to address, climate-affected areas in particular.
Thank you so much. I know it can be really discouraging for a health worker to not be effective. So I can imagine there are opportunities to retain more of those highly skilled health workers because they're safe and they can do their jobs well. So that's excellent. So how will climate change impact the surgical workforce? What existing challenges will it exacerbate? And what's Smile Train doing to anticipate and meet those challenges?
Yeah, and I loved our earlier speakers, and Dr. Carey mentioned that, things are happening already, and what we're going to see in the future is just a complete exacerbation and crisis of what we're already seeing. We know that in climate disasters and in conflict disasters, power outages are more common. We see access to power being more commonly affected. So we're certainly going to continue to see need for supplemental power like solar to be available. We're also seeing, obviously, across the surgical system that as climate continues to impact health, that we are seeing more and more climate-caused conditions that will require surgery. So what we're seeing are more and more cases of surgical disease that need to be treated, and more strapped health workers who are being called on to respond to them. So this is a massive area of need, and we absolutely need to continue to accelerate our investment in essential, solutions like solar surgery. So we're really proud of the work that we've been doing with Kids OR, with partners like Lifebox and others to really start bringing some of this change to the continent. We're very excited about seeing it go to scale.
Thank you. Wonderful. So hi, Alice. I'd love to hear more about the sorts of innovations and opportunities that you and your teams at Johnson & Johnson have identified to ensure that the most vulnerable and under-resourced populations are supported during crises. Tell us.
Great. Well, thank you for having me today, and just wanted to also thank everyone in the room for sticking with us. It's we've covered a lot of ground in a short period of time, and I think everything from a mental health crisis, our climate crisis upon us, our economic uncertainty as well. There's multiple interconnected forces at play. At this point, I've been reflecting a lot around the comments and the earlier speakers as well. And maybe I'll just start more with a question to the audience than a response. And I began thinking, are these really multiple crises upon us? Or is it really just one crisis we have? And I'm going to argue that the crisis and the big crisis we really have, the most urgent one, is a caregiving crisis. And if we really look at this as a caregiving crisis, and we think about the solutions with nurses and community health workers to invest in the backbone of our societies, it will solve and move the lever across each and every one of the different issues that we talked about in the crises coming out today. And so that's what I'm really excited about to speak on today. I'll share a couple of thoughts on how Johnson & Johnson is working in this area. We have had a longstanding mission to advance equitable access to care, and particularly through investing in nurses and community health workers. We really see this as a backbone of looking at locally led solutions and solutions that are coming from those who are closest in their communities. And I'll share a couple of ways in which we are really excited to have been doing that more recently. And I'll share three particularly. One is around equipping our nurses and community health workers. So really around training both new as well as existing health workers related to the skills they need to support their communities. I'd love to see more conversation, not just in new health workers, but also retaining those who are already in place and providing them with advancement, right? Career advancement, skilled advancement within their careers as well. Once we get to a fully skilled and closing the gap in the healthcare workforce, we really also need to simultaneously look at an inclusive, equitable, and diverse health workforce. Certainly within the communities we heard about today, in my own community and the Asian American community, we hear a lot about, or we don't actually hear a lot about the mental health crisis upon us, but it is very prevalent. And because there are cultural norms and stigmas against speaking about mental health, because the language challenges for cultural competency right here in our own backyard is there. Even if there's a healthcare worker in place, we really do need to focus on culturally competent care as well. And then finally, I'd like to just highlight connecting the healthcare workforce as well. And certainly, if we look at where healthcare is delivered today, it's not just in hospitals, it starts in communities. So how do we really make sure that we're connecting our community health workers to our hospital system so they are working together? One of the examples that I have so much hope and excitement for is right in Kenya with our CHU for UHC program that was launched by the minister last year, and really is an exciting way where a number of the partners in the room I know were also active in getting that together, related to formally recognizing community health workers, also remuneration and paying our healthcare workers, and then providing them with the skills as well as mobile phones and technology to stay connected. So I'm really excited about equipping, diversifying, and then connecting our healthcare workers.
Wonderful. Thank you so much. And And I know sometimes when we think about, health for all and prevention, these very public goods, I want to explore a bit what the role is of the private sector. And what are partnerships that we can replicate to really sustain those investments in communities and in health and in the frontline health workforce, really, all the way down to the last mile.
Thanks for that question. I feel very strongly that private sector has a very important role, not just a moral imperative, which is absolutely upon us, but also a business imperative. We live and work in our communities around the world. Certainly our businesses also are very much intertwined within a healthy civic community, an active and a secure community, and healthcare for our employees and also for the population. So very much so feel that private sector does have a moral and a business imperative to be in these conversations and to step up alongside of our civil society, our government, our partners as well. The second piece I'd probably share around here is that in addition to funding, which we also have a foundation that brings some grants to the programs, I'd love to see our private sector, and we can all do better around bringing our broad expertise to the table. Whether that be around, we spoke about supply chain, particularly during natural disasters. How do we think about continuity within disaster? We have numerous experts within supply chain, human resources, finance, our scientists, our epidemiologists. So I'd love to see private sector also step in to bring our whole expertise in addition to some funding. And then finally, I'd probably say that partnership really is the key to it. I'd love to give a additional shout out to the Frontline Health Worker Coalition here, who has really stepped up over the years. I mean, this room is incredible and what you've been able to bridge in conversations and within the representation in the room as well. And only through partnerships are we able to really solve some of these multiple challenges. And I'll end with the single crises, though, which is the caregiving crisis.
Thank you so much, Alice. Yeah, really bringing it back to people, right? The lifeblood as we speak to. So yeah, thanks for your thoughtful words. So I'm going to, I have a question for all of you. I'm going to ask that you give about a minute of your reflections as you respond. So if maybe the answer for you, Alice, is already there around what's the one thing, what's the priority area or opportunity for further investment to really promote resilience of the health workforce? What's a priority or an opportunity?
Yeah, I'm just going to go back to, I think we need to really reframe this as a single caregiving crisis. I think that narrative, it widens the tent. It brings more people in to solve a single issue with very different adaptations below, but really advocating for solving and elevating the caregiving crises. We know that there's return on investment in there from a business case perspective. We know that the narrative is there. The one other ask I would say is that we're really steep in the work. I think people are tired. And let's lift each other up. Let's lift up the stories as well. But certainly I think there are so many innovations happening, so much resilience happening. Our healthcare workforce is at the front lines. Let's lift them up. Let's lift up these stories as we progress along the way.
Thanks so much. It's so hard to pick, to try and narrow it down to one, but I mean, it's critically important that we recognize, lift up, and train the frontline health workers and equip them with the tools that they need to do the work that we're asking them to do. I think we are already behind. We're seeing compounding death and disability, certainly related to surgical disease, but related to all aspects of health. And that's just being exacerbated by climate. So we really have no time to waste in coming together as nonprofits, as private sector, and making sure that we are training at scale, but also making sure that all of these critical parts of our future have the tools that they need to be successful.
Yeah, thank you. I think it's a difficult choice, but I was looking at it from many dimensions. And I think for me, I'll go for really a lot of investment on digital, data and digital, as a big enabler to drive efficiencies across many fronts. I think case in point, just to highlight, if you look at even Africa, where most of us where I come from, is we have a double disease burden. So if you look at the pockets of money, it has to be shared across many things, climate, environment, everything else. So if we can be laser focused on the possibilities of digital to drive effectivity and efficiencies, then it can actually work across multiple layers. And both the data, the information, if we can also build the capabilities of people to effectively utilize it, then it can go span across many other fronts beyond just health, planning, agriculture, and all those things around. So I think that I'd bet for that. Thank you.
Thank you, and this is so hard. I just can add that from my perspective is digital health infrastructure, how mentioned my colleague, is our future. To improve telemedicine and the digital health solution can to improve access to healthcare and providing technologies that allow healthcare workers monitoring and monitoring the patient health. It will be necessary for patients and health workers, and useful not only for someone who stayed in a rural area and for someone who have chronic disease.
Thank you. Excellent. Super important priorities and opportunities. So I have now one final question. So imagine, esteemed panelists, you're on the elevator. You're with perhaps a minister of finance or a head of state, CEO. I've heard Bill Gates is around here. So, what is your pitch for investing in health workers? Why should we invest in health workers? You have 30 seconds. It's a nice slow elevator going from the 4th floor down to the lobby. Over to you.
Focus on cost effectiveness of the health workers team, and highlighting their cost effectiveness, we can make a strong case to investing on them. Less than 30 minutes.
Yeah, I think mine is, if you relate it, I think a lot of discussion around health workers tends to be related to crises, or pandemics and those sort of things. But actually, ultimately, investing in health workers, even at the community level, is not just about preparation for the next pandemic, but it really is building resilience and sustainability into the future. So we need to invest and invest big time. Thank you. Yeah.
I think the main pitch is it's too expensive not to. There is so much death and disability that we are seeing, and it is so costly to all of these economies. And by continuing to make these critical investments, the cost savings in the future are going to be immense. So I think it's unarguable.
I think you all know what I'm going to say. There's only one crisis. It is a caregiving crisis. And if we invest in our caregivers, they will invest and take care of all of us. And we need to equip, we need to diversify, and we need to connect our healthcare workers.
Beautiful. Round of applause for our amazing panelists. Thank you. So I am now very pleased to pass the baton to our final moderator of this event. Please join me to welcome Ms. Ritu Sharma, the Vice President for U.S. Programs and Policy Advocacy at CARE. Thank you.
Thank you so much. Do you know how when you go to these events, they save all the best speakers for the end? This is one of those events. So thank you so much for sticking around. There's plenty of food and coffee and drinks in the back. And we have this room until 3:30. 4. Okay, so we can just go on like another 2 hours. But we won't, don't worry. I want to invite our panelists. Deborah Marie Olumbo, please come on up. Is she here? Did she make it? No, yes? Oh, I'm so sorry. I guess I have an old copy of the script. So Ramatu, please come on up. Thank you so much. And Dr. Basim Birkeland, Lead Global Health Country Director from Zambia. Apologies, Ramatu. All right. So I really appreciate that we have this panel because it's really important that we hear directly from frontline community health workers. As much as we appreciate the comments of our ministers and our other dignitaries, these are the people who are doing the work on the ground, and their voices need to be front and center. So Ramatu, let me ask you, we've heard a lot from a lot of different panelists, and if you could share one or two things with this organization or this group here from the community, what would you share? What is it that the community would like for this audience to hear in New York?
Thank you very much. Once more, my name is Ramatu Jallo from Sierra Leone Community Health Worker Supervisor. I'm one of the forgotten heroes, but it's a great opportunity today for me to be in the midst of people like you. It's the power of community health worker that makes me to be here today. So that inspired me to be one of the community health workers. I have had all the discussion since I came on Saturday on the news, then from Monday yesterday, all the news is about invest in frontline health workers, blah, 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 blah. I want to tell you, now is the time. Now is the time. Question why you should invest in community health workers? That is not a question, it's a mandatory. If you want the world to be a better place for us to live and health for be the lifestyle of all, community health workers must be invested on. I'm here today. I'm lucky and fortunate to be one of the community health workers who fall in one of the NGOs that works in Sierra Leone. I'm paid and equipped, but I'm here today because I carry the voice of the voiceless, the weight of the unseen heroes or unsung heroes and heroines. I'm representing Sierra Leone here today and all community health workers in the world. Let's stop bragging about this. The message is clear. Let's act. I know there are a lot of people here who has the power, the money, the connections to make sure every community health worker is being paid, equipped, empowered. I know that. But it's just on how to do it. Just do it. Don't wait for pandemic to break out before you support community health workers. Don't. Because if you invest in community health workers, pandemics will run away. Because the community health worker is a soldier with a bulletproof. The virus cannot penetrate because we detect earlier in the community before the doctor find out what diagnosis he's gonna do or she's gonna do. So let's the world invest in community health workers. I know some of you don't even know what community means because you have bigger houses, living indoors, no neighbors, no. But I want you to know there are somebody out there who is going through a lot of difficulties. Some of the mental health cases are not, is the mind that is sick, not the body that is sick. Like for me here, I'm a role model of the impact of community health worker. If not because of community health worker, I should have not been here today speaking to you guys. Yes, so community health workers is a mandatory to invest in them, in us. And it is now. Now is the time. Thank you. I don't think I have any other thing to say. This is the message I have.
Thank you so much, Ramatu. I think yours are the words we will remember from this morning. Over to you.
Thank you so much, Ramatu, for those wonderful comments, and Ritu, and of course for the organizers of this event. As Ritu mentioned, I'm currently serving as country director for Seed Global Health in Zambia, but I'm a physician by training, and I've been fortunate enough to spend my entire career living and working in Zambia and working in underserved communities as a primary care physician. It's just been wonderful to be a part of these conversations. I want to start with just talking a little bit about what the current situation is like in Zambia as we're talking about building more climate resilient healthcare systems. Just as we were recovering from the COVID emergency, we just 9 months ago had the worst cholera outbreak in recorded history in Zambia. Over 20,000 cases. This is in the community that I work in, nearly 1,000 deaths. And then just a few months after those numbers got better, the president went on national television and declared a national emergency around a drought. And so now we've switched to dealing with all of the issues, health issues that come with the drought, including malnutrition and so many other things. And of course, superimposed on this is HIV, tuberculosis, malaria, a rapid rise in non-communicable diseases. And so healthcare workers in Zambia have had no choice but to adapt and to build resilience. Yes, I love that the conversation has been around strengthening primary healthcare. And I think that one of the things that I think we really need to challenge ourselves to do is to come up with new models of primary health care, of course, that are led by the communities themselves. One of the things that's been happening in Zambia for decades is we've been taking our most highly trained physicians, our specialists, and we've placed them in these large academic hospitals in cities, largely inaccessible to the masses. And there was a group about 10 years ago at the University of Zambia and several people at the Ministry of Health who asked the question, what if we flipped this around? And what if we trained high quality primary care physicians and community-oriented primary care, and we placed them as close to the patient as possible? Well, this is going to take a lot of money. It's going to take a lot of patience, but what would the outcome look like? And so Seed Global Health was fortunate enough to partner with the government on this. And I'm happy to say all these years later, we're starting to really reap the benefits of this. And it's really been incredible to see. I've been fortunate enough to teach doctors in this program for years. And it's just amazing to see how agile and versatile they are with these emerging threats. It's really remarkable. They go from managing complex deliveries to dealing with trauma in the emergency room. They set up the cholera tents in the parking lot of our hospital, and they work alongside community-based nurses, community healthcare workers, and it's just been amazing to see what it looks like. Just one other thought. I think that we have to be very cautious as we're thinking about healthcare workers in the community that I've been working in, that we never compromise on quality and that we never oversimplify the healthcare needs in the villages, in the communities. And I think this is something that we really have to be talking more about and thinking more about. And I think one of the questions that those of us in this room need to be asking as we're having this conversation is, are we advocating for a type of healthcare worker that we in this room would be proud to send our loved ones to? And I think the answer to this question is really going to guide where we place our efforts. And I think what we're going to find is that the best way to do this, first of all, will be determined by the community context. And I think second of all, that it's going to be interdisciplinary teams that involve people like Ramatu, community-based nurses, community physicians that are all working together to provide care that is culturally appropriate, contextually specific, and so on. And that we never, ever lower our standard of care to acceptable or basic or essential care. And that we really ensure that we're providing exceptional care. But this is going to require a lot of time and investment.
Thank you so much for that. So as we wrap up, maybe leave us with a few words of what gives you hope. What gives you hope as you're doing your work every day in communities, as you come to a rich place like this in New York City? What gives you hope, Ramatu?
Yeah, thank you for these great questions. What gives me hope is all in here. It's all around me. Because if global health, donors, partners, government come together and invest in community health workers, that gives me the hope that there's going to be a better place in the future. Also, the community itself, you also know they be trusted in the community health workers more than anything. Even these big physicians, that, all is when the community members accept to access what the physician can offer. The acceptance is the first step. During the COVID-19, yes, there are all medical available in the facilities, but who will sensitize them? Who do they trust for them to go and access those facilities being there for them? It was not an easy task. Only the community health workers. So the future of the health for this world is to empower community health workers, because they are the gap between the community and the health facility. And what they can tell us, they can never tell a doctor, because the doctor diagnoses, the pharmacist dispense, but we visit, we accompany, we pick up drugs, we advocate for them for social support. The drugs cannot go without social support, mind you. In the homes we visit, their compassion meet actions. In the homes we visit, heart to heart. For we that feels it, knows it. So that is the message I have here. Thank you. Yeah.
Thank you.
Thank you so much. I agree completely with the statements that were just made, and I don't know if I have very much to add to what was just shared, but no, I think I'm just privileged to see on a daily basis the resilience of healthcare workers who, under normal circumstances, it's a very difficult job, let alone when there's these emerging threats from climate change, from pandemics, from other things. And so I've just been honored to work alongside of them in the community when they're under constant threat. And I think despite the challenges that they face and big challenges that we need to overcome in Zambia, they're enrolling in record numbers people to become healthcare workers. So it's really remarkable to see that there's still this this drive to become to be in service to one's community. I think I'll close by saying one of the things that gives me the most hope is that I have some colleagues here from the Ministry of Health of Zambia, and I think a lot of credit needs to go to the government of Zambia. If you just in the last 3 years, they've created 15,000 positions for healthcare workers in Zambia, and yeah. And it's really, really remarkable for a country like Zambia. And next month, they're going to be hiring 4,000 more. So that's nearly 20,000 healthcare workers. And so really, this is a government that's putting into action what we're all talking about today and investing in healthcare workers. Thank you.
Thank you so much. Well, just to close this out, I think we heard some really very clear messages today from Dr. Vanessa. You invest in someone like Ramatu, an individual, you solve 20 problems at the same time. Investing in frontline community health workers is not rocket science. It's not hard. The solution is literally here in front of us, talking to us, staring us in the face. What we need to do is to create the political will, to do what the government of Zambia is doing, to get our US government and our other donors to invest in what we know works. I think one of the reasons that it has been so hard to get political will for this issue is because the vast majority of frontline community health workers are women. They're women. They're moms. They are doing this work day to day, and they will do it. They're doing it regardless of whether or not they get paid. And when we know we can get something done on the backs of women, there isn't as much incentive to do it. I think what we've heard today is is it pay now or pay later? The cost of not doing it is so incredibly high. So you are the converted. I want to ask you to fan out over New York City over the next few days. Get yourself into the building and talk to whoever you can, whatever ministers, whatever delegates, whatever officials you can. And as Ramatu said, the time is now. The time is now. Thank you.